We're back.
Are you serious?
We're back, dude. After a month delay of coming back, man. So this is Whitecoat Medicine Talks.
Together, bro.
I know, man. It's a good thing.
I'm enjoying a lot of your videos.
Well, thank you.
Awesome.
I appreciate that. Wrong channel, but
I kept thinking, see, everybody come back to our channel.
So we're talking about the NFL draft. No, I'm just playing.
It started today.
It started today, man. It started today.
What's his name got picked up?
The quarterback got
from the Aggies when he was with
really?
one time.
Oh yeah.
In college, and then his dad went to school at A&M, right? So
oh,
his
right.
dad was a great quarterback when I was there.
Wow.
Yeah. So then, when he got decided to go to A&M. But his dad was maybe all over the coaching staff. Something was up, right?
Yeah.
And so the son got discouraged and left to Oklahoma.
Wow.
So
man.
lucky Oklahoma, right?
Lucky them, man.
And so, first choice, man.
That's
awesome.
not bad. That's pretty cool, man.
Awesome.
but we're not going to talk about that today,
Okay.
anyway, man. Sorry.
I
I knew you started off on it. I was like, no, párale, vato, párale.
I didn't want to bring more up, but I guess I'll stop.
That's okay. I enjoy football too, man. But I wanted to ask you first of all about the neurofeedback that you've been doing.
Yeah. Well, I know that last time I introduced it a little bit, right?
Yeah.
So now I'm kind of like, I needed to give them, the more chunk of what it actually does.
Mm-hmm.
So I've got patients that, don't want to be taking meds for, anxiety, depression, ADHD, even like I was telling you, sleep or memory issues or chronic pain issues or whatever. So we get this exam done, the EVOX, which is the exam to sort of map out the brain and see if there's an issue where some of this stuff could be improved without having to take medication. So sort of an exam that can help decrease these things in their lives. So as neurofeedback is the issue or the treatment, and I've got some good results. People
That's
so
good.
far have felt like it's working.
Uh-huh.
And so I wanted to kind of just throw this and discuss it with you. I'm sure you have a lot of patients that they're tired of taking their meds, or they want something else. They're, maybe going to therapy too, but it's not enough. So this thing that I ran into and I heard about was just another way of training the brain. And it's an exercise of the brain to kind of self-regulate.
Okay.
So try to help the brain to be back to normal, like it should be.
Can we send you patients over here from our clinics?
Yeah, you could.
Yeah.
I mean, we have.
I know you probably do it mainly for your patients, but you can also do other patients as well, right?
Exactly. And so we'll be glad to help those that would like to learn more about it, or at least take a look at it. But yeah, so it's literally looking at a computer, and it's telling you to do certain things. So it's part of the brain that is affected once you get the test, the EVO exam. Tells you like what part of the brain, let's say the temporal parietal, is a little bit red, meaning that it's stuck. You're in a stuck position. It should be flowing. The neurons should be flowing like green, and that's what we want.
Right.
So the area that's red is where we would put the probes, and there's no pain, there's no injection, and there's nothing that you do, but it helps us direct the area of neurofeedback. So by working out that area of the brain by these exercises, it will regulate it back to being less depressed, less red, and hopefully another way of decreasing some of this anxiety.
What do you think diet has to do with all these medical issues, depression and ADHD and other things? Do you think diet has something to do with some of those things?
I think you hit it on the nose, David. I think it's all starts from there.
Yeah.
It's amazing. The better that you eat, and by the way, you look really good.
I think
and I know you've been working hard at it, and I think you're proving that to our patients, man. what you should look like or eat.
Yeah.
I mean, I think we all need to do that, as we have to give them that example.
Yeah.
But yeah, in this case, like with anxiety, I mean, if you give a person that has ADHD, here, just take all the sugar you want. I don't care how many meds you give them or how many treatments you try.
They're not going to get better. They're not going to get better. Yeah. I mean,
they're still going to be anxious.
I don't know if you saw that in that video. We were talking about sugar and how addictive. That book that I was reading shows how addictive sugar is.
You hit it on the nose.
And
when I was listening to you, I said, "That's it.
Yeah.
People need to listen to this."
They need to listen to that, and they need to understand. And it's super easy to take care of that stuff, man. You just gotta do it.
And that's the thing. Every day I'm struggling with people telling me, "Oh, but I can't leave my little panecito with coffee."
Hijo, yeah.
I goes, "Man, but you're diabetic." I know, but I still can't leave it.
Yeah.
I said, "But man, that's what's keeping you at 8 or 9." And so it's a struggle.
It's a struggle to get them off of it. But I've started to just be more firm with them, telling you have to do this, man.
But this is not a choice anymore.
Yeah, it's not a choice, man. You just have to do it. You got to change your lifestyle.
Their eye problems,
yeah.
David. I'll get the retinopathy stuff, and
yeah.
they're like, "What does that mean?" I go,
"It means your diabetes is really bad." Yes, exactly.
So,
and that's where it all starts. I mean, all the diet. The low back pains, the leg pains, the plantar fasciitis, all this stuff, dude. It's like, oh man,
Doc,
okay.
everything hurts.
Everything hurts. Okay, I know why, but we're not gonna fix it like tomorrow. It's gonna be a while. But
I think what you said is important. Be stricter. Be tough. I want you to. I want to be more worried about your health.
Yeah.
Than yourself. That's like terrible.
Yeah, it's tough, and the people that don't want to do it, but there's a lot of people that will be willing to do it.
That's the nice thing about it. I'm seeing more people that want to do the right thing.
Yeah, they want to do the right thing, and I think over the last few years, I think you've probably seen your hemoglobin A1C numbers come down.
I think so.
Because I think the treatment has gotten better, the medicines have gotten better. I mean, the idea is to get people off medicines, right? Yeah. I mean, you don't want them on medicines all the time. However, they're good.
I used to say that they were still going to be on medicines for life. But then I realized, like, oh my God, if you lose this weight and if you do these things,
you're not.
You don't need to be on the medicine.
You don't need to be on medicines, man, because it's the diet that changes. It's
almost everything.
Yeah, but everybody's used to the burgers. Everybody likes Whataburger, and at least if you're in Texas, I love Whataburger. I just can't eat it anymore, dude. Exactly. So it's just a thing. But you have to give it up. But once you give up things, it's not that bad.
I was gonna say, when you started to do it, what is it that you felt? When it felt hard.
So I started. So no, man. You left the things. I think when I started that at the beginning, I started. My meals were a little bit bigger because I was not used to doing the no snacking and all this other stuff. But then as time has gone on, the meals have gotten smaller, and I realized that hunger doesn't kill you, so you can be hungry, and it's okay. It's okay to be hungry, guys.
But Grandma said, you gotta eat.
My grandma used to do it with a little spoon and feed me, and it's like, ah!
I think that's no tell, I guess.
No. I mean, you want to be healthy.
They want to see you chunky, even little babies.
My mom made when she was pregnant with me, she ate like boxes of Milky Ways. So guess what? My favorite candy has been all these years. It's been Milky Ways, dude.
That's amazing.
It's weird, genetics and Milky Ways got ingrained into my genes.
Yeah, well,
Yeah, but all of that's ingrained, and I think it does affect your brain a lot, and I think all these things come from that. But if the neurofeedback actually helps the patients, I mean, I think that's awesome.
Yeah, it's just another tool, David, and that's what I tell people. Yeah. Like, we're just wanting to optimize everything we can to help you with these things you have to deal with,
Yeah.
Especially our new generation. Yeah. It's where we see a lot of this.
Yeah, and well, that's. I'm glad you kind of talked about it a little bit more today because that's really important.
Thank you for bringing it up.
And I like that. Hey, this is Whitecoat Medicine Talks. We're going to be making more videos briefly, but we'll cut this one short so that we can move on to the next one.